All right, so root canals. I think most of us have at least heard the horror stories, right? And many of us have been there, done that, multiple visits to the dentist, cleaning, medication, temporary filling, and then finally getting the whole thing wrapped up.
Yeah, it's not exactly anyone's favorite thing.
No, not really. But here's the thing I've always wondered. Do we really need all those trips back and forth? Like, is that really the best way? Or is it just, I don't know, the way it's always been done?
That is a really good question. And actually, it's something that's been looked at quite a bit in research. Like, is one visit enough, especially if you have an infected root canal? Or is it better to spread it out over multiple appointments? And that's what we're digging into today.
Exactly. We're going deep on this one. And, for anyone listening who's maybe dreading a root canal or just curious, we really want to help you understand the latest thinking on this so you can, feel more confident, be informed, and have a good conversation with your dentist about the best approach.
Absolutely. And the cool thing is, we're not just speculating here. We're basing this deep dive on some solid research. Specifically, we're looking at a systematic review. And for those who aren't familiar, that means it combines the results of multiple studies to give us a much broader, more reliable picture than any single study could.
Oh, I love a good systematic review. So much more data, much more powerful.
Right. It's like getting the wisdom of the crowd, the research crowd, that is.
So which review are we looking at today?
The one we're focusing on is titled Healing Rate and Post-obturation Pain of Single versus Multiple Visit Endodontic Treatment for Infected Root Canals, a systematic review. It was published back in 2011 in the Journal of Endodontics.
Okay, 2011. So not brand new, but still pretty recent in the grand scheme of dental research, right?
Exactly. And the authors are Yingying Su, Chenglin Wang, and Ling Ye, all from the West China College of Stomatology.
Got it. West China College of Stomatology. Very impressive. So for everyone listening, just a reminder, the reason we love systematic reviews is they basically pull together the findings from lots of different studies. So we're not just relying on one small study, we're getting this bigger, more robust view of what the research actually says. And that can be really helpful, especially when it comes to something like root canals, right? Where, let's face it, it's a procedure a lot of us might face at some point in our lives.
Absolutely. And if you're facing a root canal, having this knowledge can make you feel much more informed and in control of your own care.
Totally. So let's talk about the history of root canals a little bit. I mean, why has the traditional approach been to do them over multiple visits?
Well, it makes sense when you think about what they were trying to achieve, right? Back in the day, the main goal for an infected root canal was to completely clean out all those tiny little canals inside the tooth. And a complex system in there. So the idea was that you needed multiple visits to really get it thoroughly disinfected.
I can imagine. It's not like a simple filling.
No, it's much more intricate. So the traditional approach was to do a cleaning, then place some antibacterial medication inside the tooth between appointments, and then come back later to seal it all up permanently. This way, they hope to, knock out as many of those nasty microorganisms as possible.
Okay, that makes sense. But like you said, dentistry has advanced quite a bit since those early days. So what's changed?
Well, for one thing, we have much better tools now. Think about those super flexible nickel titanium instruments dentists use. They can reach and clean even the most curved and complex canals way more effectively than the older instruments.
I've seen that. They look like tiny little drills, but they're super bendy, right?
Yeah, exactly. They can navigate those twists and turns inside the tooth much better. And the irrigation techniques, like how they flesh out the canals, those have improved dramatically too. So all of this means that dentists can get a much more thorough cleaning and disinfection in a single appointment than they used to be able to.
So I guess the natural question then is, do we still need those multiple visits if we have these super-powered tools and techniques?
Exactly. And that's where research like the systematic review we're discussing today comes in. Some studies started to show that maybe, just maybe, there wasn't a huge difference in how well single-visit and multi-visit root canals reduce the bacteria.
Interesting. So we're kind of challenging that traditional assumption.
Yes. And from a patient's perspective, it's not hard to see the appeal of a single visit, right? Less time in the dentist chair, potentially lower costs, and just, fewer appointments to worry about.
Yeah. Who wants to keep going back, right?
Plus, some dentists think that minimizing visits might even reduce the chance of reinfection. If a temporary filling leaks between appointments, bacteria could get back in. So doing it all in one go might actually be safer in that sense.
So it sounds like there are some potential benefits to the single visit approach. But what did this specific review want to find out?
They were really focused on two main things. First, they wanted to see how well infected teeth healed after a single visit versus a multi-visit root canal. And second, they looked at how much pain patients experienced afterwards. Like, once the numbness wears off, how much discomfort is there? That's called post-obturation pain.
Makes sense. I mean, healing and pain are the two big things you'd care about as a patient.
Exactly. And they specifically focused on teeth that were already infected, often with something called apical periodontitis. That's basically inflammation at the very tip of the tooth's root.
Okay, so they weren't looking at all root canals, just the ones where there was already an infection.
Right. And that's important because when you have an infection, the goal is to eliminate it. But if you're treating a tooth that's not infected, the goal is to prevent infection from happening during the procedure. So the goals are different, and that affects how we interpret the research.
I see. So different situations, different goals.
Yes, exactly.
All right, let's talk about their findings then. What did they discover about healing rates?
Well, they looked at 6 randomized controlled trials, or RCTs. Those are considered the gold standard in research because patients are randomly assigned to either the single visit or multi-visit treatment group. It helps to reduce bias in the results. And these 6 studies included a total of 436 teeth, all with infected root canals.
Okay, so 6 good quality studies and quite a few teeth. What was the main takeaway?
Here's the really interesting part. They found no significant difference in healing rates between the two groups. The overall success rate was very similar, about 80.1% for single visit and 80% for multi-visit. Figure 1 in their paper actually shows this visually. It's pretty striking.
Wow. So basically, it didn't seem to matter whether you had it done in one go or spread out over several visits. Your chances of healing were pretty much the same.
Yep. And to make sure this wasn't just a fluke, they used statistical methods to combine the data from all those studies. They calculated things like risk ratios and confidence intervals, all that fancy statistical stuff.
I'll trust you on the fancy stats.
Don't worry. It basically just confirms that the results weren't due to chance. And they also checked for publication bias, which means they made sure that studies showing a difference weren't more likely to get published.
Good catch. That can be a problem sometimes, right?
Yeah, for sure. But in this case, their analysis didn't show any significant publication bias, which gives us even more confidence in their findings.
Okay, so that's healing. What about the dreaded pain after the procedure?
Yes, the post-obturation pain. They looked at both short-term pain, which is anything up to 72 hours after the procedure, and medium-term pain, which is from 7 to 10 days afterwards.
Makes sense. Break it down into manageable chunks of time. So what did they find for that initial short-term pain?
For that, they analyzed data from 3 studies involving a total of 387 patients. And here, there was actually a pretty clear difference. Patients who had the single-visit root canal reported experiencing significantly less pain in those first few days. Only about 26% of the single-visit group had pain, compared to 37% of the multi-visit group. And that difference was statistically significant.
Wow, that is a notable difference. Less pain with the single visit. I mean, that's kind of counterintuitive, right?
It is, a little bit. But the authors had some ideas about why that might be. For one, they pointed out that each time you work inside the canal, it can cause some irritation to the surrounding tissues. So with a single visit, you're basically minimizing that irritation.
Makes sense, like just get in and get out, less poking around.
Exactly. Plus, there's no need for a temporary filling with the single visit approach. And those temporary fillings, well, they can sometimes leak or even contribute to reinfection, which can definitely lead to more pain.
Oh, I see. So it's like less trauma to the tooth and less chance of things going wrong in between appointments.
Right. It seems more straightforward.
Okay, what about that medium-term pain? The pain in the week or so after the procedure?
Well, for that, they initially looked at 4 studies with 290 patients. But then they did something called a sensitivity analysis, where they excluded one study because the pain was measured differently. And after that, the difference in medium-term pain between the two groups was not statistically significant.
So it looked like maybe single visits were slightly better, but not enough to be sure.
Yeah, pretty much. Although one of the studies they looked at actually followed patients for a whole month and found that none of them, single visit or multi-visit, reported continuous pain at the 1-month mark.
That's reassuring. So even if there is some pain, it tends to go away within a few weeks.
Seems that way.
Okay, now I want to touch on something we mentioned earlier, the medication that's often used in traditional multi-visit root canals. I think it's called calcium hydroxide, right?
Yes, calcium hydroxide. It's often abbreviated as KOH2. It's an antibacterial agent, and it's placed inside the tooth between appointments. And traditionally, it's been considered a key part of the multi-visit approach, right? The idea being that you need that time for the medication to really work its magic.
Right. But I think you mentioned earlier that there's some debate about how effective it actually is.
Yeah, that's one of the things the review highlighted. There's a growing body of evidence that questions whether KOH2 can really eliminate all the microorganisms from those tiny canals.
Oh, really? So even with the medication, it might not be a guaranteed clean slate?
Exactly. And some studies have even shown that the number of bacteria can actually increase after using KOH2.
Wait, what? Increase? That doesn't sound good.
Right. So the rationale for those multiple visits and using the medication is being challenged. Some researchers are saying that with these new techniques for cleaning and sealing the tooth in a single visit, maybe the medication isn't as crucial as we thought.
So better cleaning, better sealing. Maybe we don't need to rely on the medication as much. That's a pretty big shift in thinking.
It is. And it's a good example of how research can sometimes challenge long-held beliefs and lead to new approaches.
Now, before we wrap up, I'm curious about the quality of the studies they included in this review. Did they mention anything about that?
They did. They assessed the quality of the studies based on things like how well patients were randomized, whether blinding was used, and whether there were any patients who dropped out of the study. And overall, they found that most of the studies were pretty good quality.
But like any research, there were probably some limitations too, right?
Yeah, for sure. They acknowledged that the number of studies that met their criteria was limited, so more research is always good. And they also pointed out that the studies varied a bit in their design, which can make it harder to compare the results directly.
Okay, so it's not the final word, but it's a pretty compelling piece of evidence.
Absolutely.
So for those of us who might be facing a root canal down the road, what's the bottom line here? What should we take away from all this?
I think the key takeaway is that for infected root canals, the current evidence suggests that a single-visit root canal is just as effective as a multi-visit root canal when it comes to healing. And it might even be a bit easier on you in those first few days after the procedure. Less pain, less hassle.
That's good to know because, let's be honest, I think most people still associate root canals with multiple dreaded appointments.
Yeah, I think that's a fair assumption. But this research suggests that maybe we need to rethink that.
For sure. So I guess the big question now is, what's next? Like, how will this research and ongoing advancements in dental technology continue to change the way we approach root canals and other dental procedures? It's exciting to think about.
It is, and it's a good reminder that even in areas of healthcare that feel pretty established, like root canals, there's always room for innovation and improvement.
Absolutely. And hopefully this deep dive has given everyone listening a better understanding of the latest thinking on this topic. Remember, knowledge is power, especially when it comes to your health. If you're ever facing a root canal, talk to your dentist about all the options and what might be best for your individual situation.
Couldn't agree more. Having that open conversation with your dentist is so important.
And on that note, we'll wrap things up here. Thanks for joining us for another deep dive, and we'll see you next time.
See you then.